The Affordable Care Act program that expanded the number of people eligible for Medicaid now faces an uncertain future.
Yeah, state leaders say they're working with federal officials on a temporary extension while lawmakers look toward long-term solutions. THV 11's Maya Ellison explains what happens next.
According to Arkansas DHS, more than 200,000 Arkansans utilize AR Home, the state's Medicaid expansion program. But after federal officials rejected the state's request to expand the program, advocates say this is just about more than policy. This is about access.
You can't afford health care without health insurance in this country. So
a stark reality many Arkansans know all too well. Camille Rishu with Arkansas Advocates for Children and Families says that's why programs like Our Home matter. The program uses Medicaid funding to help eligible Arkansans purchase private health insurance.
And what it does is cover people with incomes up to 138% of the federal poverty level.
The U.S. Centers for Medicare and Medicaid Services has verbally rejected Arkansas's request to extend the waiver that authorizes the program. Rishu says while coverage isn't changing immediately, the biggest concern is what happens next.
Our Home makes sure that providers can be reimbursed for services. Without Medicaid revenue, entire communities can lose doctors, nurses, specialists.
In a statement, DHS spokesperson Gavin Lesnick says beneficiaries do not need to take any action right now, adding the state is working with federal officials as it develops the program's next steps.
If nothing changes, what have you been telling them? What does that mean?
I think a lot of people are very confused right now. What's most important is that we need to make sure that we continue our program.
The governor's office says that's also its goal. Spokesperson Sam Dubke says the state is in talks with CMS about a temporary extension while working with lawmakers to build a more sustainable model that maintains access to quality care. For now, state leaders say no changes are immediate, but the future of the program will likely be decided during the next legislative session.
What comes next is making sure that we can keep people covered and take care of families in Arkansas.
In Little Rock, Maya Ellison, THV 11 News.
All right, Maya, thank you. The state has budgeted between $2 and $2.5 billion for the Our Home program in this fiscal year. It's on a 90-10 split with the federal government. The federal government share is $2.3 billion.